Hello everyone, I'm Rhonalyn Madlangbayan. I'm a first-year student nurse, and today I'll be showing you my return demonstration in performing open gloving. This procedure is very important because wearing gloves, it helps to protect both patients and healthcare workers, of course, from infection. And it reduces microorganisms of the hands, and it also provides an effective barrier to infections materials. Okay, the materials that we need to use in this assessment or procedure are the sterile gloves and the trash can here. Now that we are all set, we can proceed the procedure. First, we need to perform thorough hand washing, and this means that we need to follow the steps in performing hand washing or hand hygiene because it decreases the bacterial counts on hands and it prevents contamination of sterile equipment. This is important to hand washing or hand hygiene before and after doing the procedure. And please make sure while hand washing that your nails are properly trimmed so that you will not experience any difficulties when applying these surgical gloves. Okay, so I'm going to wash my hands. After you wash your hands, the next step we do is we should identify the patient as his or her name and explain to them why we need to do sterile gloves. Okay. Next is to check the sterile gloves and ensure that we have right size and the packaging that does not have no stain and tears. Okay, and also check the expiration date if it's valid. So as indicated in my sterile gloves, this expiration date is April 2025. So okay, the next step we do is to place the sterile gloves on the clean, dry surface and above the waist. After that, open the outside layer by carefully peeling the top layer and back, and then removing the inner package, the only handling the outside of it. Okay. Careful. Now, we're going to do is grab the inner package, lay it on clean and dry and the flat surface. Okay. And then we're going to discard it and throw to trash can. Now we're going to open the package. Before opening it, we must follow the manufacturer guide for opening it. Okay, as you can see that there are folded tabs for folding or opening the flap. So what we're going to do is lock the flaps so that our fingers cannot touch the inner surface of the gloves. So we must be careful. Now, it's already an open package. Today, we need to identify the left and right gloves. So this is the right gloves and this is the left gloves. So this is for my right hand and this is for my left hand. So each glove we have approximately 5 centimeter wide. So for easy application, you need to glove first your dominant hand. Since I am right-handed, so my dominant hand is my right hand. Okay, so we need to glove first my right hand with the thumb, first 2 fingers of non-dominant hand. Okay. So the edge of the cuff of glove for the dominant hand, and then carefully pull a glove over the dominant hand. Ensure that you are not only cupping inside the surface of the gloves. So then knit the cuff, okay, that the thumb fingers are proper spaces. So now we're going done my gloving in my dominant hand, and we're going to do is for my non-dominant hand. So with the glove dominant, we need to insert our fingers inside the cuff of second glove. Yeah. Always remember that the thumb and fingers of dominant hand should not touch and any exposed any area, and the thumb of your dominant hand must be abducted back, and we're going to careful and pull the glove. Okay. Okay. Now that gloves you can now adjust each glove to fit smoothly. And always remember that you can only touch object from sterile to sterile. Now that I'm done adjusting the gloves, you can now interlock both black hands at least 6 inches away from clothing, keeping hands above waist level and below shoulder level like this. Okay. So this is will prevent any accidental touching of non-sterile objects. Now we're going to remove that used gloves and dispose it into its proper receptacle. To do that, we need to grab the outside one cup with another glove hand. Okay. And pull the glove halfway down the palm, and make sure to do not touch the rest and turn it to inside out. Next, grab your non-glove hand and slide your fingers inside the cup. Then after that, discard into the receptacle. Now, we're done. The last thing we're gonna do is perform thorough the proper hand washing or to remove the old powder from the blouse, because it may cause contamination or that may cause infections towards our skin. And that's it for my return demonstration. And again, I'm Rhonalyn Madlangbayan, BSN 1A, a student nurse from San Sebastian, Recoleto de Cavite.